Hello everyone, I am Irshad. I am a medical laboratory technologist. So today we will talk about the HbA1c test. So what is mean by HbA1c? So HbA1c is the glycated form of hemoglobin. What is mean by glycated form of hemoglobin? So we can say that in normal circumstances, hemoglobin carries oxygen in the blood, but in the presence of excess blood glucose for a prolonged time in the blood, the hemoglobin become glycated. So we can say that it is the glycated form of hemoglobin. Like there are two types of hemoglobin. What is the normal hemoglobin, which can carry oxygen in the blood, and what is the glycated form? So when the sugar attach to the hemoglobin in the blood, so this hemoglobin became glycated, and we can say that the HbA1c is the glycated form of the hemoglobin. What is the HbA1c test? So by this test, we can measure the glycated form of the hemoglobin, the amount of the glycated form of hemoglobin in the blood of the patient. Now, what does this test mean? So by this test, we can measure the sugar control of a patient over the past 2 to 3 months. How is this test done? So this test usually require a blood sample which is taken from the arm of the patient. Is there any special precaution or instruction given before this test? No, there is no special precaution or instruction which can be given before this test. We can collect the sample from the patient at any time as per convenience of the patient. How are the results interpreted for this test? So for normal people, the value should be less than 6%. And if the value is between 6 to 6.5%, it indicates a higher risk of developing diabetes mellitus in the future. For diabetic patient, the value should be maintained below 6.9%, and if the value is greater than 7% in diabetic patient, it indicates a higher risk of many complications in future like kidney problems and nervous problem.